When I woke up this morning, I checked the weather, probably like many of you. And that's how I decide what I'm going to wear today. And it was kind of cold, so I put a sweater on. And just like that, it's so simple. And it's kind of like that for a lot of our different parts of our lives, that we check the weather to decide what we're going to do. When I go on a trip, I check the weather to decide where I'm going to go, how I'm going to get there, and again, what I'm going to wear. But it's not just only the decisions you make for yourselves. The decisions others make for you also depend on the weather. The flight I chose to take, the air traffic control uses the weather information to decide whether or not the flight's even going to go. And we're able to do all of this because weather tracking is relatively comprehensive. Weather stations are everywhere. They're in the cities, they're up in the mountains. You can even buy one and put one in your backyard if you wanted to. And where we can't put weather stations, such as in the ocean or up in the sky, we have satellite imaging to be able to fill that. And having all those things together allows us to plan our lives around the weather so easily. So today, I want to ask the question, what would it be like if we can plan around our health like the way we plan around the weather? What would it be like if I woke up in the morning and instead of just checking the weather, I can track my health and say, what do I want to wear today? Before going on a trip, can I check how my knees are doing and decide what shoes I'm going to wear and whether or not I should take that road or that road? Maybe I should take a car. But before we can even ask that question, we have to ask a different question. And that's, how do we even get that information? How do we track health like the way we track the weather? And right now, the way we track health is very different from the way we track the weather. We don't have the equivalent of a weather station for health. What we do have are hospitals and clinics, and these centralized entities of a hospital or clinic are operated by specialized technicians and doctors and nurses and have expensive equipment, and that's how we deal with our health. And you might be thinking, I live pretty close to the hospital, but you're never going to have the same health tracking capabilities as a hospital at home or when you take your kids to the park or when you're on the road for a trip. And not just that, we don't deviate from this concept of a clinic very far. What we do is if we try to get, that did not go. Well, we don't deviate, actually that worked out really well. We don't deviate from this at all, really, when we try to get health tracking out into remote places in the world, or during disaster relief, we basically pack up the clinic and then bring it out there, and then we set up clinic, and then we try to do health sensing in a different part of the world. And that's very limiting, because you can't really do this in every place and everywhere. And this is particularly an issue for global health problems when you don't have this kind of distributed sensing, and in particular for a problem called anemia. This is an issue that afflicts about a quarter of the world's population. And what it is, when someone has anemia, is they have a lack of hemoglobin in their blood. And hemoglobin is a protein that allows your body to bind oxygen and bring it around your body. And your body needs oxygen. And so when you're anemic, your body doesn't have really the capability to distribute oxygen and let your organs and your body really function. And this is oftentimes an issue when it comes to malnutrition. Malnutrition causes this issue of you don't have the right kind of basically nutrients to be able to build the right kind of blood to be able to help you with this. So what do people do now to understand this is that we have to have a complex coordination of improvements in nutrition, bettering our public sanitation, and the crux of it all is how do you track anemia? And to do this, government organizations and public health organizations have joined together to find ways to actually survey the field and figure out who is anemic. And to do so, community health workers basically pack up what's in the clinic to bring blood testing into different regions of the world. They basically go on boats through the Amazon to go up the river for a few hours and then set up shop in different communities for a few days. And people, by the hundreds, come in, wait out the door to get their blood tested, kind of like this. And you can imagine, in a few days, you got to screen for hundreds of kids, whether or not they're anemic. You know, every minute or two, you got to screen through this, and it's very stressful. Kids are crying. Babies are crying. Babies are watching babies cry, and it's a madhouse. And in the middle of it all, the nurses are trying to grab the kid's hand and stab him, and then say, "All right, let me give you get a little bit of blood." And it's pretty crazy. And you know, you do this for 2-3 days, and you pack up, and then you go to the next spot, and the next spot, and the next spot. And to be fair, in the last few years, the community health workers have done a great job in surveying the field and trying to figure out how many people are anemic. And that's how I was able to say a quarter of the world's population is anemic. But that information is outdated. We don't know right now what is the anemia in the world right now. And it's kind of like, going back to that weather analogy, it's kind of like trying to plan your flight tomorrow based on the weather that's, a year ago. And, for anemia, that's kind of like, going blind on that, right? It's, how do I know that my treatment plan for this community is actually working, and whether or not it's actually parasite issues and not malnutrition, or the vice versa? How do you plan your treatment without the right information? So what would be more sensible would be actually to empower the local municipalities to be able to do this at a much more distributed timeline, and allow school teachers or the local community centers to be able to engage and be able to do this. But it would be superbly costly to bring a blood test device at every single community that's out in the Amazon jungle, in the highlands of Peru, and in the deserts of Africa. That's just incredibly expensive. And every time you do a test, there's a disposable as well. So you need to resupply that. And that distribution network isn't there. So 2 years ago, we at the University of Washington's Ubiquitous Computing Lab took on this problem. And our solution is called HumanHuman. HumanHuman is a way of measuring hemoglobin using the smartphone's camera and LED flash. All by putting your finger over the camera and the flash, HumanHuman measures your hemoglobin levels in your blood without drawing any blood. Sounds like magic, right? The way it works, actually, is when you're anemic, the hemoglobin levels in your blood is lower. And hemoglobin is a protein that is, compound. I don't want to say the wrong thing here. That is red. And that is why your blood is red. And so when your hemoglobin level is lower, then your blood essentially becomes a little bit less red. And what the camera is able to see is that color of your blood. And with data that we collected with collaborations from the University of Washington's Medical Center and Seattle Children's Hospital, we've been able to develop a novel machine learning algorithm that can look at the blood in your finger and then equate that to hemoglobin. And you might be thinking, how do you deal with skin tone and finger size and all those things? The way we deal with that, and I'll give you a little bit of science on this, is that every time your heart beats, it pushes a little bit of blood into your finger. And when the camera looks at your finger, that color changes a little bit every single time your heart beats. And that's how we optically extract out blood and not anything else. And then by applying that machine learning, we can measure hemoglobin. And we've been able to test this in a few clinical studies, and we've been able to show that the results are fairly promising, and we've been able to have comparable results with some of the blood tests and other FDA-approved devices. And so now, what we've been able to do is partner up with organizations in Peru and have them take this out to the field. And I went into the Amazon with them to see how would this work in an actual setting. And we've been able to see some usability problems, but also been able to see how our accuracy works in the real field. So technically and technologically, we could actually just take the camera and take the LED flash and make a little clip and then measure hemoglobin using the same technology. And that would probably be cheaper if you really think about it. A phone, I mean, there's way more than just a camera and a flash. And by components-wise, it is cheaper, but when you actually try to make this into a product, it's going to cost more than a phone. The reason is that you're not making this at hundreds of millions in quantity. But phones are being made in hundreds of millions of quantity. And so when we try to take it, and probably even more powerful is that they are already everywhere. I'm willing to guess that everyone in this room probably has a phone. And these phones are in the most remote parts of the world. And so when we try to leverage the phone that is already everywhere, we can make an entire medical infrastructure simply with an app download. And the sensors that are around this picture, around this phone, are all sensors that are already in the phone. And that opens up an entirely different opportunity. It's not just the camera that we can do measurements. We can use the microphone to measure lung function. We can use the camera again to screen for pancreatic cancer. And by combining different sensors like the vibration sensor and the camera, we can measure things like blood pressure. Let me tell you how. So my colleague, Eric Larson, who's now a professor at Southern Methodist University, and Mayank Goel, who's now a professor at Carnegie Mellon University, had came up with a way to measure lung function using the microphone of your phone. Usually, to do this, you use a spirometer, which is a device that has a little bit of a little turbine in there, and you blow your lung at it really hard. Some of you might have done this if you have asthma or COPD. And this device costs about $7,000, and again, suffers from the same issue of how do you get this everywhere? How do you get a spirometer into every corner of the world to screen for asthma, COPD, and all sorts of other issues? So what they came up with is called SpiroSmart. And what SpiroSmart does is it takes advantage of when you do the same lung test, shall we call it, it's basically blowing your lung out at the device, it creates a resonance in your vocal tract. When you blow harder, the vocal tract rings at a higher frequency, and when you go down in flow, the frequency drops. And the microphone can pick up sound, so it picks up that flow through that measurement, and then uses that information to measure your lung flow. And again, just like HumanHuman, we've been able to do a bunch of different clinical tests and be able to see that it actually works fairly well, and it compares favorably with spirometers. So this is my colleague, Alex Marakakis. Love that picture. What he has came up with is a way to measure bilirubin, which is a biomarker for pancreatic cancer, using a selfie. Bilirubin is a yellowish compound that is elevated when you have pancreatic cancer, and it deposits on different parts of your body, such as your skin and your eyes. And when you have elevated levels of bilirubin, your eyes turn a little bit more yellow. It's hard to see, but what he has been able to do is to use the funny-looking glasses as a way to calibrate the color when you take a selfie, and be able to capture the whites of the eyes and measure how yellow it is in some essence, and using machine learning algorithms to be able to translate that image into a bilirubin level. Essentially screen for pancreatic cancer using a selfie. So far, what I've talked about is only actually using a single sensor on a phone. But what if we start to combine sensors and create new sensors out of that? What can we do? So one of my recent works is to measure blood pressure using a vibration sensor and a camera of your phone. What it does is, it's called Seismo, and what it takes advantage of is this phenomenon called pulse transit time. Pulse transit time is basically the amount of time it takes your pulse to travel from your heart to a different part of your body. And how Seismo measures this is it uses the vibration sensor on your phone. When you place it on your chest, every time your heart beats, it kind of vibrates a little bit, and the phone captures that using the vibration sensor. And when you put your finger over the camera, it sees when it arrives, and it captures pulse transit time. And studies have consistently shown that pulse transit time has a correlation with blood pressure. And what we've done now is to be able to bring all the advantages pulse transit time other people have shown into a phone. So if we can do this, a lab of us, come up with all these different ideas, I think if we can encourage and engage the community in thinking creatively about the sensors that are already all around us, we can take advantage of this smartphone infrastructure that are distributed everywhere and basically transform that into our medical infrastructure and create our weather station for our health. But I think smartphones aren't the only thing that we can take advantage of. What I didn't talk about was that for SpiroSmart, the spirometry technology, you can actually do that with a landline. Landlines have microphones as well. So what they have done is pick up a landline, dial a 1-800 number, and do the same thing, and that data goes to the cloud, and you can do the same algorithm that measures lung function by using the landlines that are everywhere. So maybe smartphones aren't everywhere yet, but landlines are pretty well distributed. And beyond that, we can take advantage of new technologies that are coming out that are establishing new infrastructures for us, such as a smartwatch. Smartwatches are creating also the same thing. It's basically a package of sensors, but they're on your body all the time. It introduces a new avenue to measure health. Could we start to think about measuring health continuously? How would that change the way that we interact with health? You might have a smartphone everywhere, and you might be able to measure cardiac function using what I've described, but it would be very difficult for a smartphone to be there when you suddenly have a stroke. I think continuous health monitoring is going to be able to help with that. Now, I've talked about all these cool things, all these different ways to sense health, but there's going to be a lot of challenging questions that's going to come up as we start to make all these different devices and different techniques to do all these things, such as the FDA is going to start thinking, okay, if the camera can still be used to take a picture, what about, a smudge is going to make a bad picture, but if you try to use a picture to screen for pancreatic cancer, then it's no longer just a bad picture, it's a bad diagnosis. Are we going to be overwhelmed with the amount of information about our health to not be able to know what to do with that? Those are questions that we need to be able to answer. And those are questions that me, my colleagues, and many others are trying to answer right now. Those are hard questions, but I think those are certainly worth answering. And I'm very excited by it because I would love to know what would it be like if I can plan my health just like the way I plan the weather.